So this is my cranial nerve exam. I'm gonna tilt my screen a little bit like that. Okay, so for the cranial nerves, I'm gonna assess all 12, starting with the olfactory nerve. So because I'm limited on resources and I'm at a hotel for work, you would have him close his eyes, so close your eyes. And this is assuming I've already washed my hands and already explained to him I'm going to assess his cranial nerves. You can, I want to make sure that both his nares are actually not obstructed. So I'm going to hold each side, take a deep breath in. Good. I want to make sure that he can breathe in both sides, take another deep breath in. Okay. And so now that I know that he's clear on both sides, then I'll have him take a deep breath. So sniff that for me. What do you smell?
I don't know, but I smell something.
You smell it. You should smell something.
It smells like...
Does it smell like sweet? Does it smell citrusy?
Yeah, I would say it smells floral.
Okay, so what I have is actually sanitizer in my hand, so that's probably why he can't pick up the smell. So it's sanitizer. So I want to assess the olfactory nerve. Next is the optic nerve. That's cranial nerve number 2. So I'm going to assess peripheral vision. Open your eyes. Okay. So I want you to keep looking straight, and I want you to tell me how many fingers I'm holding up.
2.
Okay. Can you see?
1.
Okay. And then this side?
2. 1.
Okay. So I want to assess for peripheral vision. I'm going to also have you cover your right eye. Okay. Same thing. What do you see? Gotta keep looking straight.
1.
Okay.
1.
Okay, and then cover your left eye.
3.
Okay.
1.
Okay, perfect. Normally I would have a scope and I would actually be able to assess like the fundi in both eyes, but I do not have that. So we'll play like as if I do have that, and so we would assess for like papilloedema and any type of enlarged vessels in the eye, any type of fundi in the eyes. So that will also go along with optic nerve, which is the cranial nerve number 2. So 3, 4, and 6, I know that we assess those together. That's ocular motor. So I'm gonna, so I want you to look straight. Like, no, look at me, right. So keep your hand straight, and I want you to just follow with your eyes. So, right, up and down. Okay, any pain when you do that?
No.
Okay. So I just want to make sure that the eyes move up and down. And then the next step, I'm going to have you like just keep looking straight, like look at my finger, and then just keep watching it. So follow it all the way to your nose. So I want to look and make sure that the eyes cross and make sure that the pupils don't react to that as well. And I also want to make sure that I'm assessing for any type of ptosis or nystagmus. So those are things that I'm looking for when I make him do that. Next, I'm going to do cranial nerve number 5. So I'm going to have you clench your jaw. So clench. Are you clenching it?
Mm-hmm.
Okay. Clench again. Oh, okay, I feel it now. Okay, so I could feel the jaws right here harden a bit. Okay, so open your mouth. Don't let me push. No, keep your head straight. There you go. Don't let me push your mouth up. Okay. So he's not letting me push it. Now I'll have you move your jaw side to side. Yeah. Okay. So I know that nerve is intact. I'm actually going to use a Qtip for this next part. Okay. So now I just want to make sure that he can actually feel like when I touch. So can you feel that?
Yes.
Okay. What about here?
Yes.
Here?
Yes.
And then what about there?
Yes.
Okay. Is that sharp or is it soft?
It's a little sharp.
Okay. What about there?
A little abrasive. Sharp.
Okay.
Soft.
Okay.
Sharp.
Okay. So I just broke off the Q-tip, and so I was touching with the sharp end and the soft end, and he can feel it. So that nerve is intact. So now I'm gonna ask you to show your teeth. There you go. So smile, frown. There you go. Okay, and then I can actually also assess cranial nerve number 7 just by watching him talk and things of that nature. So during my general assessment, taking this history, I can also assess that nerve. Now I'm gonna have you close your eyes really, really tight. Don't let me open them. Okay, puff your cheeks out. There you go. You can open your eyes now. And then clench your neck, like, there you go. So, cranial nerve, okay, you can relax. Cranial nerve 7's intact. And then next I'm gonna do cranial nerve number 8. So that goes along with hearing. So I'm gonna cover one side and I'm gonna whisper a 2-syllable word in his ear to see if he can hear it.
Baseball.
Okay.
Softball.
Okay. So I would do that. And then if I actually had a tuning device, I would do a Weber's test just to see. So I would put it behind the ear just to make sure that he can actually hear and feel the vibration that way. So next I'm going to assess cranial nerves 9 and 10. So typically we would have a tongue depressor and we would test for the gag reflex, but I do not have that. So we have to pretend that we have one. So I'll have you open your mouth and say ah. So when he does this, I want to actually stick your tongue out for me. I want to see if I can elevate the soft palate by having him say ah. So say ah. I want to look at the back of the throat to make sure that I see it elevate. So it should see it rise, and I did see it rise in him. Like I said, if I had a tongue depressor, I could press it down and check the gag reflex as well as to see if the palate elevates with that. But I don't have one, so like I said, we have to just pretend like we do. Next, I'm going to check cranial nerve number 11. So what I want you to do actually, since I have you facing this way, I want you to turn your, no, keep looking straight. Turn your chin to my hand, but try to push my hand. There you go. Okay, other side. So that's intact. And then from behind, if he was on a regular exam table, I would just get from behind and then shrug your shoulders. Push up, like push up, don't let me push down. There you go. So he's got really nice cranial nerve number 11 as well. And then to assess cranial nerve number 12, I would just look at like how he talks again, see if he has any type of like a lazy tongue when he speaks. And then I would look for any type of atrophy of the tongue. So I want you to stick your tongue straight out and then side to side, move it side to side. So you can tell that cranial nerve number 12 is intact. So that concludes my cranial nerve exam. Next, I'll do the reflexes.